Okay, we are live. Good afternoon, everyone. Today's session is going to be really helpful, and it's led by Dr. Tejashri Shrotri from Apollo Cradle and Children's Hospital. She is going to talk about planning for a family and what to consider. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Hi. Good morning, everyone, and a very, very happy Doctor's Day to all our viewers today, those who have joined us live on Facebook. So, today it's a very important topic, and I think for couples who are going to soon plan a baby, it's going to be helpful to listen to few of the tips that I would like to share with all of you. So I think, first of all, if you all have taken a decision to become parents, congratulations. And this journey is going to be very, very rewarding and beautiful for all of you. However, I am sure that you would like to know what all things you must keep in mind before you're planning to have a baby, because addition of a new member to the family certainly adds to more responsibility and a certain amount of time that you will have to spare for the new little one that's going to come to your family. So the first and the foremost thing is about the couple. So I think you must sit together and discuss with your partner to be about how you would share the responsibility of parenting. The father to be and the mother to be has to be very aware of what kind of change in the lifestyle the new child is going to bring to your lives. So both of you should be on the same page, should be on board to go ahead with the journey. So that's the first and the foremost thing that both of you should discuss it out and be there together. The second, I think, is the important point is to be on a very healthy lifestyle before you embark on this journey. The healthy lifestyle meaning that you should be cutting down on your substances that are addicting. So the first thing I would like to say is that in case you are indulging into smoking or alcohol or any kind of recreational substance abuse, that's the first thing you will have to quit. Smoking, certainly for both the partners, both the mother and the father to be, have to quit smoking because it does affect the sperm as well as the oocyte quality. Alcohol, if you are an occasional drinker on weekends or social drinking, that might be allowed till you get pregnant, but certainly the mother has to quit alcohol as soon as she gets pregnant. So that's going to be a big change. When I say that, I also would like to discuss about caffeine intake, because if you are the one who's the Starbucks or your barista knows what you're going to order the moment you enter the cafe, certainly you will have to cut down on your caffeine intake. So, as per our books and as per our theory, it is said that about 200 milligrams of caffeine a day is something that is allowed to be, intake is allowed. However, how much is 200 milligrams? So, if it is a big cup of black coffee that you're drinking in a day, that amounts to about 200 milligrams. So, maybe a one cup of black coffee in a day is something that would be allowed. But if you are, a fan of roasted coffee and indulge into 3 or 4 cups in a day, then you certainly have to cut it down to about a 1 cup a day. So I think that is something which you will have to change the moment you decide to, start this journey or start family extension plan. The second important thing is that you must see a dentist and a nutritionist if possible, so that they can evaluate your dental health, because that is related to increased risk of preterm labor and increased risk of pregnancy complications. Now, this is something we all may not be aware of, but it is an important finding that has been seen in studies that in case you have some dental infection or a dental concern, you might end up having a preterm delivery, which all of us here are a little wary of. So you should be visiting a dentist so that you are good at your dental health. And the second thing, like I said, is something that has to do with your diet. So cutting down on your carbs, taking a more healthy diet, more vegetables, more seeds, more nuts, more dry fruits, And healthy balanced diet is something that we would like all of you to have once you are planning to have this journey towards parenthood. The third thing is, I think, you should be visiting a doctor, a consultant, because she would like to know more about the medical history, and in case you are having any medical problems in the form of seizure disorder or something related to cardiac problems, or even a small thing like thyroid, has to be managed well, and your health has to be optimized before you are embarking on the journey of motherhood, because that not only ensures that your pregnancy remains smooth but also a healthy newborn. So it's very important that you visit your gynecologist or obstetrician for a preconception counseling. That's what we call as the visit, that you go to the obstetrician, get a preconception counseling done for yourself. There would be certain, few tests that she would like to run so that she can find out that you are at the best of your health when you are embarking on this journey. The second thing is that what about your routine, especially the sleep routine and your exercise routine. So just make more a time for a 30-minute walk every day, and also stock up on sleep, because that's something that you're going to miss after becoming a mother, getting sleep whenever you want. So have a sleep routine, have an exercise routine every day, and that will be very very helpful for you all to deal with all the problems, not only during pregnancy but also postpartum, when when you are taking care of the newborn. That's really going to help you to cope up with the stress that you might face at that point. So I think that is something you must take care of. Now, regarding the routine things that we go off, so something that I would like to mention is about the root coloring or the hair color, because that is something that has come into our routines nowadays, and hair colors might be a little harmful to you all and the baby, especially in the first trimester, because it is a strong chemical. So, root touch up is something that you might not want to do often once you get pregnant. So, discuss with your hairdresser, discuss with your the person who's taking care of your hair whether he or she wants to do something about it, and what would should be your routine once you get pregnant, because that's an important concern all of us face nowadays about cosmetics and hair color. Those are strong chemicals, and certainly they need to be managed before you get pregnant. Now, last but not the least is of course the prenatal vitamins and the supplements that you need to take. So, whomsoever you meet, like your obstetrician, would suggest a good prenatal medicine, because that keeps up your folic acid levels, which are very important for the baby's brain and nerves development, which happens right in the first trimester and might start even before you know that you're pregnant. So prenatal vitamin supplementation is something you should be, getting prescribed for yourself in the right dosage, so that whatever is required for the baby's initial days of development should not fall short when you embark upon this journey. I think these are the major points that I would want to cover regarding the medical and the lifestyle changes that you would need. Of course, the planning about finances and talking to the family for their support is also something that I think you all should consider, because initial few months you might need a lot of help from your family, and the two of you may not be able to manage, or it might become a little overwhelming for both of you to manage on your own. So that's something you should consider discussing with the family and the financial planning amongst yourself. I think that is all from my side. In case we have more questions about this topic, I can certainly take them and answer. Thank you so much for patient listening. It was a pleasure to be here today. Thank you so much.